Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about poor sleep or insomnia. We can have three scenarios. We can have those who have difficulty falling asleep or initiating sleep, and those who have difficulty maintaining or staying asleep. So you can also have people who wake up too early, earlier than they desire to, and they cannot go back to sleep. So you could have combinations of these three. And when we talk about again sleep, we are not just interested in the quantity of sleep. So we advise an adult could achieve or should achieve about 7 to 9 hours of sleep, and children should do more. But you could just be lying in bed and then watching your ceiling. You wake up with headaches, body aches, fatigue. You have not slept. We also think about the quality of sleep. Very important. You must have deep, restful sleep. Okay, in other words, you should be well rested when you sleep. So, not just quantity, but the quality of sleep. And my concern in this video is also not about those who could have sleepless nights because of some project they are doing, some exam they are going to write. Okay, it's just a transient change in their schedule or in their lifestyle, but that can return to normal when everything, the project is done or the exam is written, for instance. My concern is about those who have what we call chronic insomnia. 3 months or more, almost days in a week, they cannot sleep. And these are the people that can have some negative consequences when it comes to poor sleep. All right. So what are the consequences of poor sleep, or the negative consequences of poor sleep? Or what are the benefits of sleep? That requires us, of course, to look at the reason why naturally we are created with sleep. Sleep is necessary because after working out your mind, your emotions, your body, they need to be restored, refreshed. They need you have to reset. You need to be repaired, recharged, refueled. It's like you have a mobile device and you have used this device throughout the day, the battery has run down. You must recharge this battery, and you can use it again. It's the same thing. When you have used your mind, your emotions, your body throughout the day, there must be a time where you have to recharge. Sleep helps with restoring you back to factory settings, we should say. All right, so you can be well refreshed for the next assignment or for the next morning, and so on and so forth. All right, so what are the benefits of sleep? We know that sleep reduces cortisol level. Cortisol is implicated in stress. So sleep reduces cortisol level, and so all the negative consequences of stress, you don't get to have them because you sleep and your cortisol levels are normal, are reduced. All right. We know also that sleep can improve your brain function. Now you have your senses of touch, smell, sight, taste, and so on, bringing information to your brain most of the time, all the time, to process. So your brain is always working. But when you sleep, your senses are not picking so much information. Your eyes are shut, for instance. They are not picking stimuli. Your brain can rest. You wake up more refreshed with improved brain function. You can make good decisions, quality decisions. Your memories are working quite sharply because you are well rested. Your brain is well rested. Okay. Number 3, apart from just resting the brain, your entire physical body can be rested. Like your muscles. When you work, when you're out there working with your body, your joints, your muscles, for instance, climbing stairs, you climb the stairs, you go to the top level, you are panting. It means that you are breathing faster, your heart is beating faster. It means you could overwork yourself. Sometimes when you sleep, you see how your heart rate is quite reduced. You see how your breathing rate is reduced. Your tense muscles I've relaxed more, okay, because of sleep. Your eyes are shut. You are watching screen, TV, television, computer screens. Your eyes could hurt. All right, your eyes could be painful, but when you sleep, they are shut. You can be rested. So sleep also um, helps the entire body to rest. Imagine also that you are driving and you are sleepy. You are endangering your life and the life of other people. That is why I said that poor sleep can be a health hazard in a sense. All right. So, what are the causes of poor sleep? Now we can discuss the causes with the management of poor sleep. The causes can be divided into external factors and then the personal or individual factors. For instance, if I said external, if you live in an area and then you have so much noise around, all right, a pub playing loud music throughout the whole night, dogs barking, you cannot sleep very well. Your room that you live in, the environment of the room, let's say that the room is too hot or too cold, the light is too bright, the place is stuffy with a lot of clutter, you cannot, a lot of smell, the room is not comfortable, you cannot sleep. Your bed, your pillow is not comfortable, you cannot sleep. So these are external factors that can lead to poor sleep that can be addressed. All right. Then the personal factors or the individual factors can include your psychological factors, physical factors, and lifestyle factors. Physical factors implies that if you're in some kind of pain, for instance, you should find it difficult to sleep. Your back is aching, your knees are hurting, you have severe headache, you cannot sleep. Some discomfort, you are not breathing properly because you have a lung or a heart problem, you cannot sleep properly. All right, must be addressed medically. You wake up to urinate frequently because you have some disease like diabetes, or let's say you're on some medication, you cannot sleep properly. All right, you have sleep apnea. You wake up once in a while, your airway gets obstructed, so you wake up once in a while to gasp for air or to pant for air. You cannot sleep too well. All right. So these are medical conditions that are called physical factors that can affect the sleep. Then the psychological factors can include things like your mental illness, such as depression or anxiety, or some psychological stress that is giving the impression that there's some threat on your life. Okay, so you have to run and then you have to fight. So if you have psychological stress, we know that there's this mind-body connection. So if your mind cannot sleep, your body cannot sleep. Okay. Then we also have this lifestyle factors. Okay, lifestyle factors have to do with your behaviors. So close to bedtime, you cannot be consuming caffeinated products like coffee, tea, energy drinks because they are stimulants. Okay, don't exercise too close to bedtime. Early hours of the day you can exercise, but not too close to bedtime. Right, and also you have to watch what you eat and when to eat. You don't eat so close to bedtime, and when it's close to bedtime, don't eat to get your tummy so filled, and also don't go hungry. Yes, you don't get to be too full close to bedtime. I also don't go to bed with an empty stomach. All right. Then you can also have a situation whereby you respect the sleeping schedule, whereby you respect your circadian rhythm. When we talk about circadian rhythm, we are saying that your body has this internal clock that determines your sleep-wake cycle. So your brain instructs your body to wake up at a particular time and to sleep at a particular time. If you have a sleeping schedule, let's say between 9 to 10 p.m., you are asleep. Okay, that will help, regularize your sleep schedule, and then your circadian rhythm is going to work properly, other than sleeping anytime at all you want. Okay, and also avoid screens close to bedtime. If you are going to sleep and then you are binging on screen like mobile phones or gadgets, TV, television, computer screens, you might not be able to sleep well at night. Okay, don't have those gadgets around you or on your bed. Okay, if you have sleep problems. Okay, so these are some of the things that you have to look at: the external factors, the personal factors, psychological, mental illnesses, the physical factors, the medical conditions, all this can lead to poor sleep. So before you decide on sleeping tablets, make sure that you've gone through all this list, and then if you can address this in addition to that sleeping tablet, or you might even not need the sleeping tablet at all. Okay, so poor sleep can be a health hazard, and you have to take sleep very seriously. Thank you very much for watching this video and subscribe to my channel. Thank you.